Hello, and thank you for joining the Concentra webinar, Telemedicine for Workers' Compensation will begin soon. We'll give everyone just a couple more minutes to join and get settled before starting the presentation. All right, let's go ahead and get started. Hello, and welcome to the Concentra webinar, Telemedicine for Workers' Compensation. Today's webinar will be presented by Ann Schnure and Dr. Lisa Figueroa. Ann is the Concentra Vice President of Telemedicine Operations and oversees Concentra Telemed, a proprietary telemedicine platform designed for work-related injuries. She is a nationally recognized expert with more than 30 years' experience in the workers' compensation industry. Dr. Figueroa is the Concentra Vice President of Medical Operations and Concentra's National Medical Director of Health Information Technology and Telemedicine Services. She is a board-certified emergency medicine physician with nearly 30 years of experience designing healthcare software for emergency medicine, urgent care, and occupational medicine. At the conclusion of the presentation, we will have a 10 to 15-minute Q&A session with Ann and Dr. Figueroa. You can submit your questions throughout the presentation to be answered during the Q&A session. We will answer as many questions as possible within the time allowed. A recording of the webinar will be emailed to you after the presentation so you can view it again at your convenience. And Dr. Figueroa, we're ready to begin.
Hello, everyone. First thing we're going to do is briefly go through the agenda of what we're going to cover today. And the first is why telemedicine, the growing acceptance, the differences between group and workers' compensation telemedicine offerings, what are some common questions, what are some myths, what are things you as an employer, payer should consider if you're going to launch telemedicine, what are some emerging areas coming to telemedicine, and then about Concentra's telemedicine product itself and how to launch Concentra, with followed by Q&A. So first, let's talk about why telemedicine. So I tell people there's two things that really have driven why telemedicine is now the time is right for telemedicine in the work comp space. And those two things are technology, smartphones, and bandwidth. Telemedicine has been around, but those are the two things that have really allowed it to happen. So what's the force driving the need for telemedicine? Physician shortages. I'm sure we've all heard about there's counties now in parts of the United States and states that have no clinicians at all. And then access to care for both rural workforces as well as urban and suburban workforces with logistics of leaving work, distance transportation, off duty. So we know that with trends that more patients are choosing the convenience of telemedicine, that studies reveal that many visits to emergency departments, urgent care visits, and also bricks and mortar visits to a clinician as well could be properly handled through telemedicine. So telemedicine in the spotlight. As I briefly said, telemedicine has been around a long time. It's been around 60 years, started with NASA There was a need to be able to deliver healthcare remotely. It has been around with the VA, with a lot of situations by phone in the shipping areas, et cetera. But like I said, with the smartphones available now and a widespread broadband, it's finally able to be done in a cost-effective way. When telemedicine launched many, many years ago, there had to be a direct tunnel line between two sites. Usually there was a very expensive type of kiosk monitor setup that never made the product scalable beyond just a few sites. Telemedicine launched in a big way in group health in the last few years. Most large group health plans now have telemedicine in them. They're addressing adoption challenges, high patient satisfaction. They're seeing all kinds of growth in group health. Massive growth happened in group health and telemedicine in the late fall and winter of 2017 by a phenomenon called flu season, where national news media, local news, clinicians, health plans were telling people where there was a massive flu outbreak to not go to the doctor, to try to use telemedicine, to not infect other people or get the flu by going, which caused a huge surge increase in telemedicine visits on the health side. So workers' compensation, workers' comp is about 1.8% of the spend of total health care in the United States right now, and continuing to decline. And usually the trends start in the health sector first, and then workers' compensation follows. So for telemedicine that has been around, lots of choices on the health side, workers' comp might be the last frontier for these new telemedicine offerings. So what else has caused telemedicine to really take off? And that is growing acceptance by consumers and regulators. So all states in the United States have adopted telemedicine in some form. Lots and lots of discussion about telemedicine regulations. If you Google telemedicine for any state, you will receive lots of information, primarily about Medicare and Medicaid, because of the restrictions around both of those and what can be treated state by state and what they allow for. You'll find some information about healthcare plans. And by the way, none of that applies to workers' compensation. I'll talk about that. But all states have adopted telemedicine in some form. With most states all states actually accept telemedicine and workers' compensation now in some form. And we'll talk about what that means a little bit later. So we're right now with work comp and telemedicine with what we call the innovators, moving to where group health is with the early adopters. So we're following a typical uptake model for new innovations that happen. What we're seeing and at Concentra since we launched, and the growth we're seeing and how it's grown, is very typical to all new products that come out on the market. So key differences. One of the things that really causes confusion for people is getting confused about group health and telemedicine versus work comp telemedicine. And there are some important key differences. So group health, it has a different relationship with it. The group health partner, either the self-insured employer in the group health side or their TPA or insurance company, contracts with a telemedicine vendor to usually to use or a couple of them to use their telemedicine offering. And many of the plans are restrictive. You have to go to one of those providers that they have contracted with to be in network. As we all know, work comp does not work that way. You don't have that type of restrictions. There are different types of PPOs and MCOs and things like that, which we'll talk about briefly. But there is a relationship between the employee and the patient with the provider in work comp that is different than in group health. Group health, as you see, if you go to different pharmacy situations, even some really large employers have kiosks for their group health visits, which are great for strep throat, skin rashes, things like that, are really not a good situation for workers' compensation. Also, group health has, some of the kiosks have some wearables that can take blood pressure and things like that. Once again, very different model that really doesn't work well in the group health, in the work comp side. So when telemedicine first launched in the workers' compensation side, some of the big players on the group health side in telemedicine launched products in work comp telemedicine, and all of them have now left that market. They've all learned that it's such a different model, such a different product, with state forms, employers wanting reporting done differently, return to work, with work restrictions, OSHA record keeping, all of those things that they didn't have experience with and don't use on the group health side, made the scalability of doing a work comp model not a good idea, and they've all backed back out of it. Also, billing and reimbursement in the work comp sector is very different. Like I said, on the group side, these players contracted. A lot of the payers did with the telemedicine vendors. There was a fee for that contract paid to the telemedicine vendor, implementation charges, things like that. That was all paid up front. As we know on the work comp side, the billing has to be to a claim file or to a HCFA and billed. There's no way for those type of situations to be billed against the claims, and it doesn't work in the work comp ecosystem. And then on the group side, usually the payer drives the option, like I said, with a single platform. Some of the plans I've seen actually have two choices now. And then there's another one that's come out for people that have no insurance or really high deductible plans. There's some telemedicine offerings out there that only accept a credit card for the visit. They will not bill insurance at all. And they're supplying a product for people, like I said, for people with no insurance or have really high deductible plans and are just going to be paying for it out of pocket or out of an HSA or flexible spending account. There are literally probably 200 plus telemedicine providers of telemedicine for these type of visits in the group health space. If you add all of the group health people that are doing some type of telemedicine, you would be in the thousands. What are the similarities between group health and work comp telemedicine? Very similar experiences in that patients that choose to use telemedicine really like the experience. Both sides have seen very high satisfaction rates. And also, both of the learnings are the same, is that there needs to be a robust communication and rollout to really get adoption of the product out there. If you want people to use it, you have to do some type of education and implementation and rollout to actually have any level volume of visits. So telemedicine going mainstream. What do the stats tell us that's going to happen with telemedicine and where we are? And by the way, if you can see on the bottom, these stats mainly are from 2017, and this has only just grown. So over 75% of health delivery organizations use or plan to use telemedicine in the future. And that is what I said, almost all health delivery organizations, if they don't have telemedicine, they're studying it and figuring out how to use it in their system with their the type of care they deliver. And then 54% of workers' compensation professionals that were surveyed say that telehealth, telemedicine is a useful tool in containing healthcare costs. And then 80% of large employers use telemedicine to have telemedicine in their health plan, and that's expected to jump to 90% in 2019. So, like I said, it is non-mainstream. It is very common on the healthcare side. In fact, there's some health plans out there now that give people a certain number of telemedicine visits per year, high deductible plans like that. Some really interesting things being offered out there in the telemedicine on the health side. So it really has started to become a mainstream product and not just the shiny new penny on the health side, where it's just going to be part of all the way care is delivered. So regulatory perspective, what does it mean for workers' comp? So I briefly touched on that there's just been a lot of regulatory work on that. There's some two groups. In fact, there's a group called CTEL, that Centers for Connected Health, that lobbying group that work on making progress with state regulations on telemedicine, both for payments for health plans accepting telemedicine, working on Medicare rules, licensing, things like that. So work comp has two organizations that they have to, if we're as a provider in the work comp space, pay attention to make sure that you can do telemedicine. And first is every single state has a medical board and licensing requirements, and has requirements on telemedicine and licensing. So in all states, 50 states except for now Florida, if you are delivering telemedicine in that state, if the patient is there, the clinician needs to have a license, a medical license in that state. So that you start with globally from that state. And then you look at the state's global telemedicine rules, any rules and regulations they have before you even get to the work comp rules from the medical board. Texas was one of the most famous ones because the Texas Medical Board was not allowing first visit telemedicine in their state. They got sued from one of the largest healthcare deliverers of telemedicine. They settled and actually reversed their rules on that. They were one of the last states to change that. So then you go to the workers' compensation regulations in every state, and every state has different rules on that. There are states such as the state of Washington is one of the most restrictive left in the United States about telemedicine and what can be done in the workers' comp arena. To states that have no regulations at all on work comp at all. There's no regs, and basically there's nothing prohibiting telemedicine. So there's all these kind of things that have to be considered state by state. For example, in the state of Nevada, where the first report of injury that when you see a doctor has to be wet signatured by the patient, challenge, and that's why Nevada is not a good state to be doing the first visit injury-wise, because you can't get a wet signature from a patient on a telemedicine visit. Lots of work going on. The regulatory activity going on is a lot. And I would say any state, if there are no regs now, does not mean that there won't be regs coming out shortly, because the state might be working on them. There are several states that in the work comp arena that have working groups. Tennessee, Oregon, Georgia, Colorado that are working on regulations with working groups right now. So what are some work comp telemedicine options? So I'm going at this point. I am so sorry. The key considerations is Ahmed versus a generalist, single visit versus continuity of care, and a phone versus video. And there's all kinds of ways, different ways that telemedicine is being used. There's a triage only option, and that is where triage is done versus via telemedicine and maybe phone or video. By the way, several of the work comp regulations in states that have weighed in on telemedicine say that it has to be done only by video. It cannot be done by phone. A big word of caution, because most of the states that are working on regulations are all going to be making it video. So a phone visit for a telemedicine visit isn't going to be accepted in many states. Lots of models out there where they're doing rechecks only, and that means the patient seen in the bricks and mortar, and at some point their care is moved to telemedicine, to video. And then there's a one and done model, usually done by some type of generalist that is doing a one and done, kind of like an urgent care model, where they don't do any follow-up care in telemedicine. They would be seeing the patient only on the first visit, and no continuity of care. And then there's a comprehensive model where there's occupational medicine experts. The employee can begin their care and stay in telemedicine for the right use case and the right injury. And the video visit can be done for their full treatment plan, which is the one Concentra offers. So now I'm going to turn it over to Dr. Figueroa. Yes.
Thank you, Ann. Sorry, I was a little premature there in the intro, but so let's talk about common questions. And Ann and I do lots of presentations around the country, and so some of the more frequently asked questions are, what can be treated via workers' comp telemedicine? And I'll go into a little bit more detail on that answer here shortly. Can an adequate evaluation be made via video? So the answer is absolutely yes. The interaction between the patient with the clinician via video allows for the clinician to get a detailed history from the patient, mechanism of injury, and also to do a comprehensive examination, video examination. So the patient is mobile, the device is mobile, So whether it's a smartphone, a tablet, or it's a detachable camera on a monitor, the patient can take that camera directly to the area of injury. They can ask the clinician can ask the patient to perform range of motion exercises. They can ask them to do strength testing. Because they're mobile, if there are lower extremity injuries or back injuries, they can follow the patient and watch their gait. So absolutely an adequate evaluation can be done via video. And what happens if additional visits are required? So Ann had mentioned that many visits that start in telemedicine will continue in telemedicine. Now, we know that not all visits are appropriate for telemedicine, not all injuries, I should say, are appropriate for telemedicine, but those that are, typically we start the visit in telemedicine, and if additional visits are required, we schedule that patient to return to the center to the telemedicine for recheck. If, in fact, the patient's condition is not appropriate for telemedicine and they're there with the clinician on telemedicine visit, the clinician, rightly so and appropriately so, refers the patient for in-person care. So whenever there's a question or concern that that injury is not appropriate, the clinician will send the patient or refer the patient for an in-person evaluation. How secure is telemedicine for injury care? Very secure, as long as you're using HIPAA-compliant software for that video interaction with the patient and the clinician. So no FaceTime or other applications that are not HIPAA-compliant. Is there any legal risk involved? Now, so the very brief answer to this is the legal risk is the same as it would be for an in-center evaluation. So clinicians follow the standard of care in telemedicine as they would in a bricks and mortar facility, so the legal risk is the same for both. Is it easy to implement? Yes, it's easy to implement. Important, and Ann will go through this in more detail, is to make sure you have the right people in place, education and communication throughout the organization, both on the employer side and with your telemedicine vendor. Will employees use it and like it? Well, history has told us that the answer to that question is absolutely yes. So, thousands and thousands of visits, workers' comp injury cases tell us that employees will use it. And our rating system within our current Concentra Telemed solution allows us to look at what patient satisfaction scores we receive, and they absolutely like it. Will it save me money? So this is the employer asking the question, right? So I would say the answer to this question is, if the patient joins telemedicine solution to see a clinician timely. So a lot of patients that get injured at work, they often wait until it's a convenient time that they see a clinician. Not always, but often. So if the patient sees a clinician in telemedicine timely, if they're compliant with their recheck visits, if they follow the protocols and the treatment plan that the clinician has asked them to follow, then the case duration will certainly be shorter, and that's where your money savings comes in. So some of the telemedicine myths and misconceptions, and we've heard a lot of this out on the road, if you will. Lots of questions asked of us. Is telemedicine only used for triage or first aid? No. The answer is no. That is, telemedicine I just mentioned, we can see the entire injury case if it's an appropriate visit, and it is certainly beyond first aid. So we have medical clinicians, physicians treating these patients, and certainly beyond first aid cases. And we'll talk about those that are appropriate in just a few moments. I already mentioned a thorough physical exam is possible via telemedicine. Lots of questions asked regarding is it in fact a comprehensive exam, and the answer is yes. Now, certainly we don't have the ability to do comprehensive neurological examinations with all of the cranial nerves tested, nor can we do a thorough eye examination, but those are then not appropriate for telemedicine. The primary benefit of telemedicine is to address after-hours care. That is a myth and misconception because there are opportunities 24/7, 365 for these patients to be seen. So when they're injured, they can join telemedicine and be seen. Following an after-hours telemedicine visit, the employee should be transferred to a brick-and-mortar facility. That is incorrect. Ann had mentioned those are the cases where they're seen initially and then transferred to a brick-and-mortar. This is, again, the entire case can be seen. So after hours, if the patient's seen via telemedicine, we will schedule that patient for a telemedicine recheck when appropriate. And telemedicine can't be used to treat the entire work injury case. I've mentioned that several times. It absolutely can. So frequently cited benefits, and we've heard many of these in lots of telemedicine presentation and in the literature, access and convenience. So it's getting that patient the injury care that they need, being seen by a clinician timely. So within minutes to hours of the injury happening. More likely not minutes, but hours after the injury has happened, and especially in remote locations or after hours. It says especially in those areas, but again, urban areas, access and convenience, it's traffic, there's, transportation issues. So yes, especially in remote locations, but certainly urban locations, it's access and convenience during those times as well. Employees can receive care at the workplace, at home, or on the road. So this is a huge value add for the patient. They don't have to travel to a center, wait in the waiting room, wait to be seen by the clinician, then after the clinician is seen, be checked out of the facility, and then drive back to the workplace. So they can have their telemedicine visits work, home, or on the road. And no need to arrange transportation. That I stated already. So the cost, we talked about reduced case duration, the fewer emergency department or in-person urgent care visits. That's really applicable for after hours. So when a telemedicine appropriate injury is seen after hours, there's no need for an emergency department or urgent care visit. And improved productivity is because we keep the patient at work for as long as possible. So key considerations when you're considering a telemedicine solution is to make sure that you review the technology and the equipment and make sure that it's HIPAA compliant, that you have access to video and audio. It supports the workflows that are important to your organization and your injury care specific workflows. Supports electronic medical records. There's actionable reporting so that you're able to give information back to the employers regarding outcomes, regarding patient satisfaction, and the accessibility being 24/7 and 365 should be added there. The experience of the provider is extremely important. So we're talking about occupational medicine. We're talking about workers' comp injury care. We need clinicians that understand that medicine and the way to practice injury care medicine and OCMED. So clinicians that understand OSHA recordability, that understand return to work, that understand the communication to the employer is critical with these injuries. We need clinicians that embrace telemedicine and technology, that utilize the same electronic health record across the network, so continuity of care is important. Confirm that the clinician is in network with the payer, very important. So when we look at workflows, we talk about workflows internally within the telemedicine workspace, but also the workflows at the employer location. So when a patient gets injured, when an employee gets injured, what are the workflows that they follow? How does that first report of injury happen? How does the patient get to telemedicine to be seen for their injuries? So you have defined workflows, and those are followed. And communication. So once the injury visit is complete, the employee needs to have clear instructions on their return to work, so their activity status information. They need to also understand when they're rescheduled to be seen and to follow their home exercise program. We need to make sure that we notify the employers immediately on the patient's activity status and their return to work. and the TPA payers and managed care receive their timely clinical information to support that continuum of care and that claims management. So just like we would in a center for an injury care, all of these, the communication needs to be timely, and it needs to take into consideration that the employers as well as the payers need it, all of the specific information for that particular injury case for that patient. So when you're implementing a solution, a telemedicine solution, and Ann will speak to this in more detail, you need to make sure that there is pre-planning. So that pre-planning includes choosing that telemedicine provider and ensuring the health experience. I mentioned how important that is, that clinician understands the health space, and that they understand state regulations and best practices. So in the pre-planning phase, you want to make sure that you understand whether there are fees that are associated with the injury care visits, whether there are equipment, technology fees, and what are the fees for that specific visit. Understand the equipment needs and provide a private space for the patient. That's extremely important. If you're implementing a solution and you have that employee have their telemedicine care at the workplace, they must have a private space. The private space is determined by the patient. So if they say they are in a private place, that's the primary criterion. The patient has to feel they're in a private space. Education. So identify and engage advocates within your organization. So make sure you have the right people that are involved in the initiative. Leverage existing processes and workflows. There's usually no need to redesign a workflow and redesign any processes. It's usually very easy to follow your current processes and just institute a telemedicine solution with those in mind. And obviously, we need to make sure that the telemedicine workflows and processes are explained to stakeholders. Building awareness. So you have your telemedicine solution in place. You get your buy-in from your leadership. You promote the offerings to the employees. Make sure they understand that they can receive their injury care with telemedicine and exactly the process they need to follow in order to do that. Make sure the patient experience is a good one. That's absolute paramount with telemedicine. You need to ensure a user-friendly approach so that the software is easy to access, that there's a streamlined and integrated process so the patient understands exactly what they need to do to join a telemedicine encounter to get their injury care. So monitoring and reporting, also extremely important. So you institute and implement a telemedicine solution. How is it going? How are the patients feeling about their experience with telemedicine? Look, how are the outcomes? And all of that is extremely important when you're implementing a telemedicine solution. So emerging areas in telemedicine, Ann mentioned wearables. Wearables really looking at solutions that are non-invasive alternatives for continuous 24-hour monitoring of health, activity, mobility, and so forth. And peripherals is a little bit different. So peripherals are the opportunity to connect via your software for telemedicine, a stethoscope, an otoscope, being able to examine the patient with these peripheral units that allow for the physician or the clinician to examine certain areas of the body that would not be able to be examined without them. Additional use cases for telemedicine, behavioral health, I think is a phenomenal use case for telemedicine, and it's a very fast-growing area of telemedicine. Bloodborne pathogen exposure, I know that that's been tackled in the industry, looking at whether or not it's an appropriate use case for telemedicine, but in fact, it is a wonderful use case for telemedicine, and Concentra Telemed is doing this successfully to date. So very nice use case. Consider your bloodborne pathogen exposures and telemedicine. travel health and postoperative recovery, as well as specialists utilizing telemedicine for their care. So about Concentra Telemed, we've been talking a lot about telemedicine in general, but Concentra Telemed is an application that the employee would download on the App Store or the Google Play, and they would download it on their smartphone or tablet, and we talked about mobile devices. That application would then give them access to our clinicians and receive their injury care. So the platform can be used for new injuries and injury rechecks, and it is an application that is supported 24/7. So other things we mentioned are convenience, and I mentioned that in generalities, but for Concentra Telemed, we are available 24/7, 365. Injured employees can receive care at work, home, or on the road, and minimal wait times and no interruptions. So again, no transportation needed. Patient can be seen timely for their injury. Easy access we talked about, access via their computer. They can use a home computer that has a detachable camera, and that's also a permissible way to have a telemedicine visit. Our access is nationwide, so that's also very important. Care quality, we have clinicians that are Concentra clinicians. They're employees that are trained to the Concentra model, and so they have occupational medicine experience and training. So that concern about OSHA recordability, understanding return to work, and understanding the importance of the communication with the employer are all a part of Concentra Telemed. So keeping the employees working for better productivity, so we manage the claims and the costs with fewer emergency department visits, get the patients working more quickly, shorter case durations, as I mentioned, decreased time to first injury care, as well as compliance with their recheck visits so that we can decrease those cases. Can use Concentra Telemed to manage treatment throughout the life of the claim. I must have said that many, many times, but I think that is a huge value add for telemedicine. We mentioned security and HIPAA compliant platform. That is extremely important. So our platform is HIPAA compliant. Our patient records are stored in the EHR and not on the video platform, so no documentation, no patient information is captured on that video platform. It is all in the electronic health record. And this is a frequently asked question, are video visits recorded? And the answer is no, they are not. So this I mentioned earlier. I was going to talk about what can be treated using Concentra Telemed. So we treat initial injuries and work-related illnesses. And if you look at this list, we talk about grade 1 and 2 upper and lower extremity strains and sprains. That really equates to, in lay terms, relatively minor strains and sprains of the upper and lower extremity. And I say relatively minor because some of the minor injuries were misinterpreted as first aid, but we certainly see beyond first aid injuries. We do see first-degree burns, the back strains and sprains. We absolutely see those, and those we see those patients that do not have significant limitations. So if they're in a wheelchair, or if they're not able to walk, or they're have significant pain and limitations in their movement, those are not appropriate for telemedicine. Neck strains and sprains, same as the back. We see lots of contusions, and those are contusions without deformities. And the contact occupational dermatitis. So this is the landscapers of the world that may come in contact with these plants that may cause these rashes. The tendinitis and repetitive use injuries. Those are the tenosynovitis of the shoulder, the wrist, the carpal tunnel syndromes. Those are some examples of repetitive use injuries. And as I mentioned earlier, the bloodborne pathogen exposures. Excellent use case for telemedicine. Patient gets exposed, They get an opportunity to speak to a clinician very quickly, and they relieve a lot of that anxiety. Patients get their blood work done on an outside facility, and then we see them again and recheck, and it is an excellent use case for telemedicine. So, Ann?
Very quickly, we're going to talk about how to use Concentra Telemed to get started. So the most important thing is the patient, the employee, injured worker, needs access to a quiet, private location. And privacy is up to the patient to determine if they're in a private place, and it is a requirement. They need equipment, computer, mobile device, iPad, smartphone. It does not have to be theirs, because as Dr. Figueroa explained, we're not putting information that's going to be downloaded onto anybody's device that someone else could read a patient's medical records. So they just need to be able to get to have a device, and of course an internet connection, and they do have to have an email address. It's part of the log-on information when they create a profile. We also ask for a valid photo ID and a signed authorization from the employer. All very simple things to do. On mobile, they downloaded an app from the App Store, and we are happy to help. We provide 24/7 support, and happy to help anyone that's struggling with downloading an app, filling out the information on the app, etc. So on the next slide, we're going to very quickly talk about the employer billing for telemedicine services. Lots of confusion about this, and it's very straightforward. It comes on a HCFA. It is a one-line code for the visit with a 95 modifier, and then in the location field, it's a 02 goes there. 02 tells the system that the care was delivered virtually, and same as the 95 modifier. A couple of states have already ruled in that you cannot weigh in on the fact that you can't add a technology fee onto there, that it's not something that you can bill on a HCFA. So if you do use a provider that wants to charge an implementation contract fee or charge for usage of their software, it cannot be put on the medical bill. It has to be paid some other way. At Concentra, we don't ask for a contract, an implementation fee. We don't charge for language fee. If we need an interpreter, we provide 283 different languages if someone doesn't speak English. And we also have care coordinators, and we don't charge for the care coordinator who does the intake as well. So the bill looks just like bricks and mortar, but that's how you will clearly identify it as telemedicine. Plus, it will say that it was a telemedicine center the care was delivered at. So, employer reporting. If you're going to use telemedicine, you should expect quality reporting. You should be able to get information on how your telemedicine program is going. You should receive information and an ease of use for the patient and the employer. At Concentra, we have an employer portal. If the employer uses that for bricks and mortar, they're going to receive their telemedicine reports exactly the same way as bricks and mortar. They're going to look the same. And they're going to utilize them the same. Of course, a patient can't walk out of a telemedicine visit with paper, so we're going to email the patient their activity status and their summary of their visit after every single visit, and they will get those two reports within minutes after their visit is over. So which states accept Concentra Telemed? Concentra is currently live in 38 states. There are some states we've chosen not to go into because of regulatory issues, and other states where the population of the state is very low and we don't currently have bricks and mortar, but we're live in 38 states, which covers 87% of the population of the United States. We're in a big chunk of the United States, and happy to discuss any questions with anyone about any specific state that we are not in. We're 24/7. 365 days a year. So we're open on Christmas and Thanksgiving. If someone's injured, night shifts on the Thanksgiving, you're going to be hard pressed to find many places open. Concentra Telemed is open. So what do you need to do to be successful to launch Concentra Telemedicine? This is one of the things that we have learned is you need to do some pre-planning to really have a successful program. the big question as an employer is, where are my employees going to do their telemedicine visit? If they're going to do it at work, where is that at work? They need to have privacy. Am I going to use a sick room, an office, a conference room? Every single employer has walked through this, and no two have done it alike. Everybody's had to solve for what works in their workplace. Then they're going to have to decide on devices. We've seen employers that have a large population of employees in a single location, like a distribution center, warehouse, purchase iPads, use laptops, that type of thing, where that piece of equipment is going to be used often, to go ahead and get it set up for telemed. We highly recommend you don't do this if there's only going to be a few visits a year, because equipment, if it doesn't stay used and turned on, often people will spend time taking updates on the computer or the iPad to get it to work. And then make sure there's communication, that the supervisors know about telemedicine, safety, whoever the person reports their injury to, partner with nurse triage, that there is communication about the program, that it's a benefit, and why it's a good thing. And like I said before, make sure you partner with all the people involved in that work comp ecosystem, whether it's a TPA, nurse triage, nurse case manager, etc. Devise an effective way to communicate and do training. We provide all kinds of support. We have all kinds of literature and marketing materials and things that have been customized for an employer. We try to take the work out of it for an employer, where they can just customize what we've prepared. And then make sure that you have an engaged workforce, that they know how telemedicine works, how Concentra Telemedicine works, and understand the benefits. We've seen the utilization of telemedicine jump tremendously when someone's done these things. And then anytime there's a way to build awareness in any way, some people have SharePoint, portals, email blasts, anything like that. Always, like I said, Concentra's Help has even samples to use to leverage this to be able to encourage utilization. So with that, we wanted to give a little bit of time before we go to the left side to any questions at this time.
Oh, yes, we do have a number of questions. Let me just scroll up here and go through them. Thank you for everyone who has submitted questions so far. We have a question from Karen. If an employee starts treating physically in the office, can they switch to telemedicine?
So the answer is yes. We are working through that with all of our, across the United States. We're doing a pilot right now where they can start in bricks and mortar and go to telemedicine. There's, of course, the bandwidth and broadband issues we're solving for, equipment and all that. But the answer in a nutshell is yes. We also see there's just a great use case for people that don't follow up their care, that they often don't show up for the last visit or two because they're feeling better, but they haven't been released full duty or released from care. A great way to get them seen and full duty released is through telemedicine.
Have there been different results for a represented workforce or union environment?
We have done presentations to lots of employers that have unions, and actually have presented to some unions as well. And what unions like about telemedicine so far, when our approach to it is, please don't make it mandatory. Present it as an option that someone can easily turn down if they're not comfortable doing it, and it's a benefit to those who want to use it. And so far, we've never had a union at any employer we've been engaged with say no to telemedicine when it's presented that way.
Okay. How will using telemedicine affect or reflect on my OSHA 300 reporting and lost time? Can this help me reduce my lost time and EMR?
So OSHA reportable record-keeping rules apply to telemedicine just like they do bricks and mortar. So in that regard, what I tell people is telemedicine, for the list of injuries appropriate for telemedicine that Dr. Figueroa went through, That it's great to send those to telemedicine because you're providing the right level of care for the right injury. So you're not going to get it overtreated at an emergency department or urgent care, get someone that's going to end up with something more than an over-the-counter prescription or durable medical equipment more than they need that will make it OSHA recordable. Dr. Figueroa, do you want to add anything to that?
Nope, that was beautiful. Thank you, Ann.
What is the typical wait time to connect with a clinician through telemedicine?
Year to date, our average wait time is 8 minutes. Of course, there's outliers that happen sometimes at peak times, but the average for all of our visits in 2019 is 8 minutes from the time the care coordinator puts them in the clinician waiting room to when they connect.
How do we price Concentra Telemedicine, and what do we typically charge for visits?
It's exactly the same. It's usually a level 3 or a level 4, depending on acuity, complexity of the visit. But most of the visits are 99203, and they're billed exactly the same as they are in bricks and mortar. Nothing, no add-ons, no anything different. We bill them; they look exactly the same. Of course, whatever the fee schedule is in the state, and of course any contracts or anything like that would be applied to our bricks and mortar, applied to telemedicine.
What does HIPAA compliant equipment and HIPAA compliant video mean?
So Dr. Figueroa touched on that a little bit. It means that using something like Skype or FaceTime to have a clinical, a medical visit is not HIPAA compliant, because the video, first of all, to even have a video encounter, there has to be some permissions and some documenting about privacy and granting permission, et cetera. And then the documentation about the video event itself, that all has to be stored on a server in a way that data is protected from anybody else's data. To make it HIPAA compliant. And so off-the-shelf Skype, FaceTime, any type of video experience like that is not HIPAA compliant. Anybody that's doing telemedicine, any vendor or whatever, would certify that their product is HIPAA compliant. One of the things that people get confused about often in work comp is because they say workers' compensation doesn't apply to HIPAA. HIPAA doesn't apply, which means correctly that an employer and TPA, et cetera, have rights to the patient information without medical authorizations, et cetera, in that regard to HIPAA. But that provider and patient relationship is still subject to HIPAA and privacy laws as well.
For those states that are not eligible or available for Concentra Telemedicine, are there efforts underway to get regulatory approval? I am particularly interested in New York.
We are working on New York, and I'm particularly interested in New York. So New York does not currently have any regs that prohibit telemedicine in work comp, and their head of work comp medical, Dr. Figueroa and I gave them a webinar on telemedicine. We had a great conversation. At the end of that meeting, we thought we'd really made some headway. So their current stance in New York is that it specifically says in the state regs that telemedicine is an accepted form of treatment under the health plans, and work comp is silent. So they're not quite sure how they're going to interpret that. The Work Comp Bureau was ordered to do a study on telemedicine this year. They didn't do it. They are behind. We've offered to help them, and stay tuned.
Does the employer have to purchase peripherals in order to participate in telemedicine through Concentra?
No, and in fact, we really discourage people from purchasing peripherals. So, the peripherals, the ones people talk about a lot is the dermoscope, which allows you to see the skin magnified or whatever. And here's the issue with peripherals is they have to be maintained. They have to be clinical grade. They have to be kept clean and in working order. They have to be used enough to even know they're working correctly. All the things that I would caution any employer taking on that type of responsibility sanitizing, storing, making sure they're kept cleanly, etc. When the camera quality and our ability to zoom in and see the type of things that those type of peripherals do, we just don't have a problem. In fact, if we have a concern, we will send the person out to bricks and mortar.
Would the providers through the Concentra Telemed app be the same providers that are seeing patients at Concentra clinics?
Maybe.
Not necessarily. So
yeah, you go ahead and answer, Dr. Figueroa.
Okay, yep. You were doing so well there. I hesitated. So not necessarily. So we do have a full staff of telemedicine dedicated physicians, but we also have center clinicians in our bricks and mortar facilities seeing telemedicine patients as well. With the rechecks that Ann was mentioning earlier, those clinicians and centers will see the patient in brick and mortar, and if it's appropriate for a follow-up for telemedicine, let's say they put sutures in, they're doing a 2-day wound recheck, they can schedule that patient for a telemedicine recheck. In that case, the center clinician is seeing their own patients via telemedicine.
Okay, we have a question from Melissa. We are in Washington. What are the limitations related to Go Live?
So the Washington State has a working group on telehealth regulations, and it's been glacial, the progress this year. I try to attend each of their sessions, dial in and listen to them and get their information. And I actually have the deck from L&I, their latest deck on their stance on telehealth. The biggest issue for work comp is that in the regs, in the L&I's regulations, and filling out that very first report in Washington, it states in the regulations that there must be a hands-on physical exam, and that they will tell you that means that the patient needs to be seen face-to-face, and that the regulations would need to be changed.
How well have workers' comp carriers accepted the use of telemedicine?
So we have partnered with all of the big carriers, had discussions, presentations. No one has said no to it. Every one of them probably is on a different journey and spending time and looking at it and getting comfortable with telemedicine in that regard. But I can tell you they're all looking at it, all figuring out how to get it out to their customers, their employers, and communicate it in some way because they all see it as the future and trying to figure out how they do that best. So I can tell you that any work comp carrier of any size in our space has already spent time on this topic.
Are the patients guided through a self-exam? For example, how do you typically approach an ankle injury following a fall?
Yeah, so the answer is yes. It's a self-directed examination. So the clinician will ask the patient to, have the camera pointed to the injured part. They would look at that area. They would compare it to the opposite part that's non-injured. They would have them focus the camera close up from a distance, do range of motion. Watch their gait. So yes, I mean that is certainly visits that we see very, very commonly are the upper and lower extremity musculoskeletal injuries, and perform fairly comprehensive examinations. The key is to have a mobile device, which is critical, and we won't have a visit with them if they are not able to get either a detachable camera or a mobile device with a camera to have their visit.
Will the employer still receive appointment detail reports after a telemedicine appointment?
They will. It will look and feel exactly like what they would receive in bricks and mortar.
All right, we just have time for a couple more questions. What percentage of telemed patients are referred to be seen at a clinic?
That is a great question because I have to first preface it by it depends on the type of patients we receive. So we have one employer that, especially at night, sends us patients that have a little bit higher acuity to keep them from going to the emergency department. And we end up having to refer a much higher percentage of those out to be seen in bricks and mortar, and they know that. We also have another situation where there is an access to care issue, and we see a much higher acuity patient on Hawaiian islands now as well. So if you take that away, it's about 10 to 12% of the patients we see end up being referred out to bricks and mortar at some point.
If an employee is treated physically in the office, can they switch to telemedicine?
Ultimately, yes, we're working on it. But yes, that's the long-term goal that we're getting at. That in all states where we're doing telemedicine, that flow will be able to happen. We're working on, like I said, we have to get equipment, bandwidth, training, all of that. We chose our path to launch for the first visit first for telemedicine because it seemed to be what the marketplace was really wanting, was that 24/7 solution, and that was kind of our stage 2 product that we're working on now.
Okay, we have one more question, or rather time for one more question. Would Concentra still wait on authorization from the company nurse on call, or can any employee just log on to the app?
So authorization to treat is handled the same in telemedicine as bricks and mortar. We follow the employer guidelines on that. Some of the employers give us authorization to treat in the portal. Some email it to us. Some fax it to us. Some, if they come through nurse triage, have standing authorization. So whatever the employer guidelines are. We even have employees that hold up the authorization to treat on camera for us so we can see it, and we'll snag a picture of it. We've had the supervisor come on even to the video for 30 seconds and give authorization, but we make sure, ultimately we wouldn't turn a patient away, but we've never treated a patient. We've been live since June 2017. We first saw our first patient. We've never treated a patient yet without authorization to treat. In fact, we've had two different times. It's only happened twice. When we told the patient we were getting authorization, they hung up on us. So probably the same that happens in bricks and mortar.
All right. Thank you both for the excellent presentation. As a reminder to everyone in the audience, a recording of the webinar will be emailed to everyone who registered after the presentation if you would like to view and listen to it again. Thank you for attending and have a great day.